We've moved far, far away from making big incisions over the past, generations to making small laparoscopic incisions and using instruments that we use with our own hands. What that allows me to do is do a deeper excision, removing the same tissues that I might have been doing otherwise, but through those same small holes, but with even less trauma to the patient.
Our robotics program started with our Da Vinci robot. When I came on board, Dr. Meltzer and I met, and we determined we wanted to show our community and region how we stood out. We started down the road of looking at different accrediting bodies to become a center of excellence in robotic surgery.
The Center of Excellence is that stamp of approval, differentiating us from other national hospital groups and surgeons. What it really does is it communicates to the community that we are growing, and I think everyone knows that, but what we're doing here at Kootenai Health in particular is working really hard to make sure that we have the best systems in place to adapt to that growth that allows us to attract the kind of surgeons that we want here to take the best care of the patients in this region.
I think what sets us apart is all the different specialties that perform robotic surgery. We take each individual person and their specific diagnosis or their surgical need and really determine what is the best route for them to get the care. We're not just jumping to the easiest, fastest way for them to get care. We want to make sure that we're providing what they need to meet their desired outcome. And so I think it's really that individualized care model that not only our surgeons, but our staff also really focus on. And I'm really happy to be able to be a part of that. And I think by implementing and getting the accreditation for a Center of Excellence, that just takes us a step higher to really show patients that we do take their individualized needs into consideration for whatever they may need.
While my specialty uses this system a lot, we love that we can combine our processes with the other divisions that use it in similar ways, but also in their particular ways, because each of us has learned to use this robotic system in different ways. And over time, when we share, then we can all raise the level of our game.
Everyone here at Kootenai Health wants to ensure that we are providing the top quality and safe care to the community and the region. We never stop learning and growing, and so I think that this is just the first step for us to continue to grow our robotics program and really see how much more we can achieve within Kootenai Health as a center of excellence.
We have a supportive ecosystem of surgeons and administrators and staff that allow people like me and other physicians who want to work in the same way to reach what I think is like the limits of our capacity, our limits of our abilities. When we have an ecosystem that gives us both space, time, and materials that lets us work at that level, it's attractive to us, it's super beneficial to our community.